Good afternoon, everyone. This is Eric Leenson, one of the co-directors of the Business Alliance for Healthy California. Thank you for attending the call this afternoon. I need to see the slide. So, by the way, this is our very first webinar, so bear with us as we go through this. We hope it's the first of what will be an interesting series of events that we'll be sponsoring over the coming months. But I want to just kind of go through what our afternoon is going to look like. We hope to make a presentation that will last, perhaps 25, 30 minutes maximum, so that we have time for questions and answers. And because there are so many people involved in the call, we'll give you the opportunity to write your questions in, and we'll try to answer as many of them as possible. So we're going to start out this in several sections. First, we're going to have an introduction to what is the Alliance, and also talk about the status of SB 562, why single payer, some of the general principles of how it works, and also get into the national perspective that's been developed in conjunction with the American Sustainable Business Council and a new organization called Business Leaders Transforming Healthcare that operates on a national basis. So, as I said, I'm Eric Leenson. I'm a founder and co-director. Dan Geiger will be joining us, and it's possible that Richard Master, founder and CEO of MCS Industries, will be joining us as well towards the end of the call. He's on the East Coast, involved in some meetings, so we'll see if he can do that. He would be representing the Business Leaders Transforming Healthcare. The Alliance was founded recently in January 2017 as we saw the dire need to step up and discuss from a business perspective possible solutions for what needs to happen in healthcare in our state and in our country. We are members of the Healthy California Coalition, which has really been leading the charge here in California for a Medicare for All type program. We currently have 110 businesses and business leaders that are endorsers of our Healthy California Alliance and also supporters of SB 562. We are a project of the American Sustainable Business Council, which is a national organization that works in a number of different themes related to sustainability, and certainly the healthcare issue is one that pertains to all U.S. businesses. And as I mentioned, we are affiliated with Business Leaders Transforming Healthcare. What is our mission? Well, please go back. Yeah. First of all, I should start out from the gate by saying our mission is to really secure decent health care for all Californians and all Americans. It's pretty shocking what the state of our healthcare system is, as many of you are well aware, and we think it's absolutely imperative that we make changes. We believe the changes necessary can really only come through a universal healthcare system, as exists in all the other major industrialized countries around the world. So we're committed to a universal healthcare system. We believe that business has a crucial role to play in this. And again, I want to reiterate that we're committed to this because we think healthcare is a human right and something that needs to be dramatically improved in this country. At the same time, given the situation of healthcare, it also is a business issue because healthcare currently is funded and provided largely by private employers. So you can't separate the two. And lastly, it's going to also be absolutely critical that the business community play a role in making the shift, that we need to look at various sectors in our society to become mobilized and articulate with regard to these changes and make sure that our national and state leaders hear these. So as we look at the business case, what we're doing is trying to evaluate the potential for the universal healthcare system by looking around at other systems to see how they operate. We want to educate interested parties. We want to propose suitable solutions and really inform both the public and business sector of our findings and of the need to press forward with this in conjunction with national and regional business groups. So, fortunately, as I mentioned, as we began our organization, we were lucky to find out that there was already functioning in California the Healthy California campaign. And that campaign has done an exceptional job in mobilizing support for Senate Bill 562 over the past few months. As you know, that bill went through the Senate and was passed by the Senate several weeks ago in the beginning of June and moved over to the Assembly. Now, in the passage of the bill, there was not a financing part included because the idea would be that as we went into the finance, as we went into the Assembly, it would be possible to really amend the bill in a number of ways to make sure it covered all the different areas of vital interest that need to be spelled out in the bill. So it was taken to the Assembly. And as many of you have learned in these past few days, unfortunately, the Speaker of the Assembly, Assemblyman Rendon, decided unilaterally not to allow the bill to continue forward. It should have been sent to from the Rules Committee to other appropriate committees for discussion and debate. And I want to really reiterate here that that debate that would have occurred in the Assembly would have brought to bear a number of important issues and amendments that could have resolved many of the outstanding questions about the issue. Unfortunately, the Speaker decided not to allow for that discussion to happen in the Assembly, and there is an active campaign underway to try to get him to reverse his decision and allow the bill to go forward to the Rules Committee. I want to encourage people on the call to contact the Speaker and, importantly, your own Assembly people to urge them to tell the Speaker that they want to have a debate and, if appropriate, a vote on this bill. I think it's quite important that the will of the people be heard regarding this crucial initiative. In any case, should that not happen, this becomes a two-year bill and will be taken up again in the state legislature next year. As we move towards that point, we will need to be thinking through what are some of the amendments that might be added to the bill to explain and define a number of the issues. So number one is a financing plan. Now, a financing plan has been presented. There was a study conducted that Dan will be talking about shortly, a very comprehensive study on what the costs would be and how they could be paid for with several options. We'll be getting into that in the body of the call. Other policy implementation issues would be discussed, would be defined and discussed. And also policy implementation referring to how payment would be made to the providers for the various services. That's an issue that's come up a number of times. And lastly, among others, and there are others, are transition plans, because this is a major economic shift in our state, representing anywhere from 16 to 20% of the economy. And it's going to mean changes in the nature of employment. And there will be folks who will need some help transitioning into new jobs as the system becomes more efficient. In other cases, the change will add many new jobs to the payrolls in California as medical services become more widely available to a larger part of the population. So let me suggest that we move on to the next stage, and I'd like to pass the microphone over to Dan Geiger.
Hello, everybody. I'm just noticing somebody messaged that you all can hear someone talking in the background. You should all be on mute. Not sure what's happening, but if you are not on mute on your phone, if you could turn that on, that would be great. And do let us know if you have any other problems like that by typing something into the question box. So I'm going to get into just making the case for single payer. And I think a lot of you on this webinar already understand this, so I'm going to try to go through this fairly quickly. We have several very good reasons to do this. First and foremost is it's the right thing to do. It's the best thing for Californians and it's the best thing for the American people. Why? Well, there's over 50 million people who struggle with healthcare bills in our country. That's 20% of our population. That's, in my view, not acceptable for a developed country like the United States. Out-of-pocket expenses push 20 million lower income people into poverty. Again, that's just not right. 28% of people put off getting needed professional care because of costs. We can't have a healthy country under these circumstances. 60% of bankruptcy filings are related to medical bills. I think we all know of stories of people who have been in terrible situations of getting hundreds of thousands of dollars of bills that they can't pay, and it can really destroy people's lives. So it's simply not a workable system. It's broken, and it's not serving the interests of the American people. Reason number two, our economy is being eaten alive by this system. And we're going to play a little video for you from some people who know a thing or two about what they're talking about, who could probably say all this better than I can.
Healthcare costs are the tapeworm of our economy. Healthcare costs is 17% of GDP. People talk about corporate taxes, which are 1.5% of GDP. Healthcare costs is 17%. That is an enormous competitive disadvantage for this country. If you go back to 1970, there were half a dozen countries that were spending 7% of GDP on healthcare, and we were one of them. And we've gone up to 17, and they've gone up to 10. So we've got a very major problem in this country. We can't keep doing this.
But Warren was right, because our manufacturers have a huge competitive disadvantage caused by the health system, because the manufacturers provide the medical care for all the employees. And the European companies we compete with offset off on the government. It's a huge disadvantage. And of course, the cost goes up 3, 4, 5, 6% a year. So how can we fix it then? Well, it would be easier to fix it if you had a benign despot. A benign despot would create a single-payer system with people being able to opt out into private care that was a little faster or fancier. But I think having a basic level of care for everybody with no insurance aspect as a right, I think it's a good idea.
So you
Now,
were,
for a Republican, that's a very unusual way.
I was about to say, so you are saying a single payer system is really the answer?
Yes. And I think you people will live to see it.
Well, I think these two gentlemen know a thing or two about what they're talking about. Interesting to me that Charlie Munger, as a Republican, is advocating for a benign despot to implement single payer. So it's two very refreshing leaders of the business community in our country, and we thank them for those comments. Reason number three, you know what? We don't get what we pay for in this country. And I think a lot of you know the numbers on this. I'm just going to run through some, but we pay more than twice as much as the industrial world average for healthcare. We pay twice as much for prescription costs. And we're nowhere near twice as good as anyone else in the country. As a matter of fact, we're number 37 on the World Health Organization rankings of healthcare systems. This is a measure of a form of efficiency, they call it, which is dollars spent against healthcare benefits delivered. So paying twice as much, and we're number 37 in the world after Costa Rica. Once again, I'm going to say it, this is not acceptable. It's broken. Reason number four, there's a tremendous amount of waste and complexity in the system. And I'm going to guess that nearly everyone on this webinar has experienced this in one way or another, dealing with your insurance company and trying to sort things out, and who's in network and who's out of network, and all the various things that are part of our current system. So for example, the administration costs for doctors. Now, on average, doctors' offices are spending about $84,000 to handle insurance. How many of you have been in a doctor's office and see this army of people sitting behind the desk? And I often wonder, like, what are they doing? And they're processing bills and payments and all kinds of other things. And it's crazy. I'm sorry, but it's crazy. Oops, sorry. So, and I think probably a lot of you are familiar with this. So in our commercial healthcare insurance system, about 80%, 80 cents on a dollar is actually goes to healthcare providers. In Medicare, it's 97 cents on a dollar goes to the providers. Where's that 17 cents going? Well, it goes to administrative costs, marketing costs, and net profits for insurance companies. Not necessary. Reason number 5, and from our point of view, this is a message we're really trying to communicate to the business community. It's good for business. Single payer is good for business. Why? Well, there's tremendous cost savings for employers and employees, and we'll get into the numbers in a little bit. A reduction in HR and administrative overhead. All those folks in the benefits department, you won't need a chunk of them. They can do other productive work other than, managing paperwork and managing complexity. Risk management. What a relief for an executive not to have to worry about how much premiums are going up next year and factoring that into labor negotiations and profit projections and everything else. It will no longer be part of the picture. Improve care. All employees will have care, will have a healthier system and a better healthcare system, which could lead to better workplace performance. This can also stimulate entrepreneurial activity. There are a lot of people who would like to start their own businesses, but are afraid to leave their jobs because they would lose their health care. Obamacare has helped this to a considerable degree. It's given people some flexibility, but with what's happening in Washington, we can't count on that continuing. And with insurance that's no longer tied to an employer, then people are free to move jobs, to start their own business. It could generate a lot of new entrepreneurial activity. And lastly, it will give California a competitive advantage. As I hope you all heard the Warren Buffett and Charlie Munger thing. I see a couple of messages that it was hard to hear, hard to understand, but one of the cases they made was that for manufacturing, countries in Europe and Canada have a tremendous competitive advantage over the United States because they don't have to pay healthcare costs for their employees. So it's a huge economic advantage for us to have a single payer plan in California. So let's just kind of quickly go through what are the basic features of a single payer plan and SB 562. So first of all, it's pretty simple. There are complexities in it, but the fundamental idea is pretty simple. Basically, you have a public agency that organizes all the financing. It is not what some people claim to be government-controlled healthcare. It is not the government that's delivering the healthcare to you. It's the government that manages the finances and the payments. Healthcare itself is delivered through the private sector, as it is today, through doctors, hospitals, and so on. So healthcare remains private. It's no longer tied to your job or your employer. One of the great things is that all Californians are covered, including the uninsured and those that are underinsured, which are quite significant, actually. We'll see that in a moment. And you as patients, you would regain your choice of doctor and hospital, and doctors would regain autonomy. So there's no longer in-network, out-of-network. Basically, you can kind of go wherever you want, and doctors don't have to deal with all these issues. So here's a representation of how the system would work. So essentially, there's about 70% of expenditures on healthcare are currently public funds, and that's through Medi-Cal, Medicaid, and tax subsidies for employers and others, and the Affordable Care Act premium subsidies go into it, and also employer and individual contributions. So we'll see a breakdown of how these numbers kind of come out, but basically those sources of funds would go into the Healthy California Trust Fund, which would then pay for prescriptions, healthcare providers, and care coordinators, and including institutions like Geiger. The advantages, okay, relax, peace of mind. How many people are stressed on healthcare all the time? How much time did anybody spend trying to figure out which plan to get on Obamacare? It's maddening. So this gives us peace of mind, and we have guaranteed free healthcare. This is about freedom, people. This is about freedom. This is about the freedom to choose. This is about not being restricted or boxed in by bronze plans and in-network and out-of-network and all kinds of restrictions and conditions and surprises that bite you in the back. This is about freedom. This will save you money. It will save businesses money, and that's going to be money in your pocket. And this is a clean and simple system. One payer, one system, no mazes to figure out, no hassles. It's a great relief, provides great relief for businesses, as I already mentioned, reduces overhead, helps you manage risk, and so on. And as I said, it improves California's competitive advantage. Of course, it's a question that always comes up, yeah, what will it cost? And I think you've all seen the headlines, and so many of the folks that have talked about this, they all talk about this $400 billion cost. Well, that's a very misleading and misrepresentative number. So I'm going to talk about some of the numbers that come from a study done by the University of Massachusetts at Amherst, the Political Economy Research Institute. It was just released at the end of May. These numbers and this analysis forms the basis for what the bill's sponsors are working on to incorporate financing into the bill. So it's a starting point. You know, this is not the final word, but it's a very, very solid and thorough report. And I'm going to make a long story short, but today we spend in California around $368 billion on healthcare, and that's both public and private expenditures. To cover the uninsured and the underinsured, it would bring the total cost for California up to a little over $400 billion. So that $400 billion cost is correct. What is not included in those headline statements is that about 70% of that is already paid for by public funding. So it's not like we have to raise $400 billion of taxes. So the savings, though, that are implicit and explicit in a single payer plan are about 18%. And that then brings the total cost for providing healthcare to all Californians to around $331 billion, less than what is being spent today. So you can see on this, of that share, around $29 billion is added to include coverage for the uninsured and the underinsured. So the single payer system, and the study goes through this in great detail, looking at many different components, but essentially it is saving about 18% system-wide, and 13% of that is through structural savings on simplifying administration, and a big thing is negotiating drug and payment prices to providers. You know, as you probably know, like in this country, for example, in Medicare, it's prohibited to negotiate pharmaceutical prices, and that's one of the main reasons why we have such outrageous prices in this country relative to other countries. We're not paying for the cost of medications. We're paying for exorbitant profits, and that can be negotiated with the buying power provided by the people of California. About 5% of savings are projected to be realized through diminishing unnecessary services, improving care delivery. Prevention would be a significant component. When people have free and open access to healthcare, they will be able to utilize it more and prevent bigger problems down the road. And also a bit of reduced fraud would bring down the costs as well. So that will save us a total of around 73 billion on that 404 billion I mentioned. Oops, all right. Oops. So how is it financed? So the option that's the main option that's in the study that's on the table now, and this is one option, there are other things that could be considered, is to finance the system with a 2.3% sales tax, and that would include a lot of exemptions that are currently under sales tax, like housing, food, and certain other items, and a 2.3% gross receipts tax on businesses in California. Now that 2.3% gross receipts tax, it's for only revenue that's generated within California, and there is a $2 million exemption. So many small businesses that have revenue under $2 million would not have to pay anything. And that's a huge savings for small business. This is a very good proposal for small businesses. There is also a second option that's also in the study of a payroll tax, which would be estimated to be 3.3% on the employer side and 3.3% on the employee side. There's a lot of detailed analysis about this that we can share with you. It's a little bit too much to get into on this webinar. So we're going to include it on the slides that we'll put up on our website, and you can find some tables that compare numbers, really comparing apples to apples on that one. On average, this scenario would save households around 9% on healthcare, and that's the money in the pocket for a large number of middle-income Californians. There's differences in that number for low income and higher income, but overall, it's a big savings for the people of California. Businesses also would save anywhere from around 1% for the very large employers to up to 22% for the very small employers. A lot of them, a lot of businesses would be in the range of 10 to 15% savings. So this is a big deal, and it's a big benefit. And just by the way, this is being recorded, and you'll be able to see this on YouTube and on our website. So that's the basics of the healthcare system. I'm looking to see if Richard Master has joined the call to talk about business leaders for a healthy California. Oh, you are? Okay, great. So yes. Richard, let me just do a quick introduction. Richard Master is the founder and CEO of MCS Industries and has been a really visionary leader in mobilizing the business community for a single payer plan nationwide. And he's joining us by phone from New York to tell us a little bit about what's happening nationally and the organization he helps get started, Business Leaders Transforming Healthcare. So take it away, Richard. And hopefully, if you can't hear Richard, please send a message through the question box. Otherwise, we'll assume it's good. Okay, Richard.
Hi, this is Richard Master. This is Richard Master. I'm the founder of an organization called Business Leaders Transforming Healthcare, and that campaign is being run by the American Sustainable Business Council out of Washington, D.C. And actually, I'm traveling today with David Levine, who's the president and founder of ASBC. And we're been on a road trip actually for on and off for about 3 months, talking to influencers, key people in media, the economy, etc., who can assist in changing the mentality in the United States to make healthcare for all more acceptable. Okay, so MCS has its headquarters in Pennsylvania, and we also have an operation in Rancho Cucamonga, California. We have a substantial distribution center, a number of employees there as well. Let's talk a little bit about what Business Leaders is trying to accomplish, and we have affiliate organizations all across the United States. Oregon is very active in healthcare reform, and they have a 4-year plan leading to a plebiscite in 2020. And we know of your activities, and we're very impressed with what's going on in California. So what BLTH, business, it's an embarrassing tag. I'm sorry for that. But what we're about is providing media tools and also providing representation through the American Sustainable Business Council at the right time when California is going to need waivers from the federal government to achieve the transition of federal financing, current federal financing, Medicaid and Medicare dollars flowing into the California system. So we will not provide the legal assistance, but we will help to provide the political assistance to accomplish those waivers, which will require some vote by the Congress. And as far as tools are concerned, I recommend that each one of the listeners today try to get a hold of our two movies. One is called Fix It, Healthcare at the Tipping Point, which addresses the issue with our multi-payer insurance, complicated insurance healthcare system. And the second one is Big Pharma Market Failure, which was recently introduced and deals with the high cost of pharmaceuticals in the United States and what to do about it. Those are available on blth.org. They're also available through fixithealthcare.com. I know you have a lot to accomplish, and I want to express my appreciation to Eric and Dan for inviting us to participate in the call. We also urge that each one of you, if you're involved in a business or a business owner, to please consider joining BLTH and also consider joining the American Sustainable Business Council. They're a wonderful organization and really in lockstep with our basic principles as progressives. So thanks so much, and look forward to working very closely with the California Initiative.
Great. Thank you so much, Richard. I don't know if you're able to stay on the line or not, but we're going to start delving into questions. We've been getting some questions coming in through the question box.
Let me add one thing, Dan, and that is that if you're a business owner or are a business person, please be sure to consider also endorsing the work of the California Business Alliance and supporting SB 562. You can do that on our website, which should be easy to find. And also, if you're not a business person, we would really like to encourage you to talk to your colleagues and to your friends and family members who do have businesses here in California that should know about this opportunity and join in. In the near future, we hope to be producing some materials that people can take around to local businesses in their community and begin educating them about why it makes sense for business owners to support a single payer type plan.
Okay. So Richard, I don't know if you're still there, but one comment, it was fabulous that you have Richard Masters on. His Fix It video is spectacular. So kudos to you, Richard. Okay, so let's dig into a couple of questions. So let's see, which ones
They're a little bit hard to read, actually, because they're truncated.
So somebody asked about the scenario of the 3.3% option. How would I put up that slide?
Okay, go ahead and put the slide up. Sure.
Right. Someone asked about what the payroll tax scenario is. We do have a slide about that I'm going to find. So this slide shows the savings that would be realized through the gross receipts methodology. And the column to pay attention to is the one on the right. And you can see from the top moving down at small, medium, large size businesses by number of employees. So you can see a small business that's already paying for health benefits under 9 employees saves 22%. That's whopping for a business like that. The medium-sized businesses, it's a very significant savings, certainly less than 22, but anywhere from 7 to 14, 13, 14%. At the high end of the very large employers, there's a very small amount of savings. So this kind of scenario skews to benefiting the small to medium-sized businesses more relative to the larger businesses. So we can also take a look at what a scenario would be like with the 3.3% employer and 3.3% employee payroll tax. And it's a bit of a different story, but savings still across the board. Except for those small businesses that are not providing health benefits, they would have to pay the 3.3%. And this is on the part of the business. Also, the employee would also have to pay. So there's some increased costs there. Those who are now paying health benefits, that benefit goes from 22% to like 18, 19%. The mid-range, it's pretty similar, but the larger businesses do realize a bigger benefit under the payroll scenario. Obviously, this is sort of a question of scale, right? And a lot of larger employees probably have higher salary structures. So on a percentage basis, their healthcare expenses would be less than for a small business. So that's the scenario for that.
One of the listeners wrote in regarding a book written by Dr. Elizabeth Rosenthal called An American Sickness, which we would strongly recommend that people read if you want to understand much more about the excessive costs and the wastefulness of our current healthcare system. That's An American Sickness by Dr. Elizabeth Rosenthal, which has come out very recently. And I should add that, some of these questions we're having a little difficulty reading because in our system it's truncated. We can't see the entire question. Once we're finished with the call, we will look through them thoroughly, and we have the names of the people who sent the questions in. To the extent possible, we'll try to get back to you and at least point you in the right direction to answer your questions, if not engage in a discussion.
Okay, we have to talk about them. The revenue, Medicare and Medicaid.
Okay, someone wanted us to go back to the revenue pie that showed where the funding would come for the California Trust. So let's go back to that slide if we could. No, I don't.
So yeah, let's see. It's from here. So I think they asked about to talk further about the current Medicare, Medicaid, and tax subsidies.
And we should add there, what we're really talking about are public monies that are already in being spent for healthcare. And so what we've got are Medicare coming in, Medicaid. Now, obviously, that could possibly be changed depending on what happens in Washington, D.C. Obviously, that's one of the most controversial issues within the Republican repeal plan. So, we'd have to see. Also, along the same lines, we'd have to see about the waivers that could come to permit the state to administer these programs rather than the federal government. But just to sort of fill out the other things there, when we talk about subsidies, we're talking largely about the fact that employers get tax breaks by paying the health expenses of workers, in the sense that they don't pay Medicare and Social Security taxes on the amount that is spent as health care. It doesn't count as personal income for the employees. So there's a significant amount of money there. But additionally, we need to look at the fact that there are many state and municipal expenses involved in healthcare, which are just being paid by other public tax streams. Obviously, you have all the employees and retirees of different municipalities that are receiving healthcare, and that's being paid for with public dollars. So I hope this gives kind of an explanation of why that piece of the pie is so large. But that's the reality, and that makes it even a bit more infuriating that we're already paying so much from the taxpayer pocket, and we're not getting the kind of health care that we deserve for that.
Let me just add that the question about Medicare and Medicaid comes up a lot, and the bill is written at this point in a way that there will have to be an agreement or arrangement made with the federal government to have the federal funds go into the California Healthcare Trust. But the bill is contingent upon that happening. If that is for whatever reason doesn't happen, it would not be able to go into effect. So the bill does address these issues. There is a precedent for that. In Hawaii has been able to, not in a single payer sense, but has made some of their own arrangements about that. But I hope that addresses that question.
And let me say, it's very useful for us to be getting your comments because these are things that we want to take into consideration as we're attempting to formulate our ideas from a business perspective of the best way to go in providing single payer. And this is great to have input on what these issues are all about. As the Business Alliance, this is one of the things that we want to encourage in the sense of really, exploring and having dialogue about what a system that we're designing should look like.
Yeah, I'm seeing a couple of questions like Kevin Kreitman is asking about, is there consideration of a sliding scale payroll tax? And there's another comment about vets should not be taxed. So I think it's just useful to point out at this point is that, particularly I would say, if we assume that the bill is going to become a 2-year bill, there's going to be time to really kind of work on these different scenarios. We all understood and know that the bill as it's written today is not complete, and that the folks sponsoring the bill were working on fleshing out a lot of these details. So I think what we'll see is an opportunity to kind of look at these different scenarios. So there's not a yes or no answer to these questions, but there is a comment that's a very good question. Let's look into that. And I think we need to kind of play out some of these scenarios and see what they would mean.
But one thing that should be clarified here, which wasn't the question, but I think it's relevant, is that nothing would change with regard to the VA medical system. That would not come under the California single payer. That would remain part of the federal program.
Yeah. Okay, let's see what else we got here. Will healthcare get authorized indication about waiting lists? So the question of waiting lists comes up a lot, and it's an interesting question. So many people point to supposed studies about Canadians being on waiting lists. And the fact of the matter is that Canadians are overwhelmingly very, very happy with their system and would not come to the United States for healthcare because it's way too expensive. So we have, in effect, a waiting list and a rationing system in the United States now, but it's based on your income. It's based on your ability to pay, and it's not based on availability of services. So we think, it's conceivable that there could be some waiting list for non-urgent matters in a system like this. There is a bit of that in Canada, but it's a pretty minor issue. There's many studies that demonstrate this, that refute the common refrain one hears from certain sectors in society that Canadians all have to come to the United States for healthcare. Well, when I was in Sacramento visiting legislators, there were people who told stories about a couple in Michigan whose husband was from Canada and he developed cancer, and you know what? He moved to Canada to get treatment, and it didn't cost him anything, and he got excellent treatment. So I think that's really, it's important to kind of really reframe these questions about what is access to healthcare mean. And single payer clearly provides far superior access to healthcare for more people than anyone else, and not just the wealthy.
And I might add here that Dan pointed out during his presentation that, and Warren Buffett certainly did, they were being eaten alive by healthcare costs. Well, the reality is, until we can get more cost control, into the system as well, we're not going to be able to really grapple with these mega companies and giants that basically charge, what the market will bear. And if we think we're in bad shape now, I think it's really a relevant question to ask, well, what's going to be like a few years from now if we don't begin seriously controlling costs? And I think we have seen over time that in other countries, we haven't really tried it yet here, is that the single payer system where you have this tremendous demand and you have the ability of an authority to negotiate is really what cost control is all about. And it's difficult to imagine making progress in that area unless we are able to implement a system where it's possible.
Okay, seeing Kevin Kreitman, is that how you pronounce it, has a question. What does the payroll tax replace? Both sales and gross receipts. The payroll tax would replace the gross receipts in the scenario that the study played out. So basically, that one graph of gross receipts that would be swapped out, and payroll tax would go into that. The sales tax would remain the same.
And Georgia Brewer has asked for a comment on potential workers' comp savings, and it is contemplated within the legislation that these savings would apply to the medical portion of workers' comp. So that would definitely fall within the single payer framework.
Yeah, and Leyland Jung has a comment. Savings should show actual dollars, for example, for middle income family and other income levels. We do have that information. I think what we can do is we'll take all these questions and answer them and send them back to folks. But the slide that we have now showing household savings, that's an average number for middle income. The basic story is the lower income people actually save less because they pay less to begin with if they're on Medicaid. Higher income people, I think, would save a little bit, but the very high income people would pay a little bit more. It's pretty small. It's like in the 1% to 2% range, as I recall.
But it's also important to reiterate, and I don't want to lose this. I mean, all of us want to save money. We certainly don't want to be paying extra dollars for inefficient healthcare. But what we're talking about here also is the fact that we would solve this complex dilemma we have in our country, where I believe it's a huge moral issue about who should get health care, what services should be available to everyone. And what's interesting here is under this kind of scenario, there can be both savings and we can resolve this issue once and for all of health care for everybody.
Okay, I've seen a question. Is the University of Massachusetts study available publicly from Deanne McCallan? Yes, it is, and it is available on our website, ba4hcal.org. If you go to the resources tab under economic analysis, there is a summary there that you can read, and there's also a document that's a summary form that you can download. And you can download the full report if you want to read 84 pages and see all the data and all the references. Yeah, I think you can also find it on the Healthy California website, and there's also links there. So all that's publicly available.
And then one person wrote in a question about, will this include dental? And yes, the answer is yes, it would include dental. And someone wrote, will this presentation and supporting materials be posted online? Yes, it will be. And as Dan mentioned, it is being recorded, so you can share this with friends, hopefully especially business friends. Again, visit our website, Business Alliance, BA4 for Healthy California, HCAL.org. I'd also like to mention that we're very interested in putting together a calculator for businesses to see what would actually be their savings or not in the real world if these different options were in fact implemented. So if you're interested in participating in that, go to the info section of our website, go to the contact section and send us an email letting us know. Again, I want to emphasize that we'd love to have you on board as an endorser. At this point, there's no membership fee or anything. We want to try to mobilize as many businesses as possible to be able to speak out on this issue. So we'd love to have you join our alliance.
Okay, let's see, Deanne McCallan has a question. Does SB 562 go back to square one in the 2-year plan? Does it have to repass? I don't know that I can answer that completely. I would say, the plan has a ways to go to be fleshed out in all the details. The plan is not complete yet. The study is a study. It is not yet written into the bill. It will, for the sponsors and the nurses and others, it's forming the basis for the development of a financial plan, but that plan has not been put into the bill yet. So that's all still to be kind of spec'd out. But I think the general idea is this analysis forms the basis for constructing a plan, but I think it's probably going to go through, some changes.
Yes, and again, that's why it's particularly unfortunate that the bill was pulled basically or stalled in the assembly, because that was going to be the next step. There would be a couple of months here within the hearings that would take place in the assembly to look at these issues and kind of resolve them.
Alan Moskowitz is saying, instead of calling it single payer, others suggest calling it healthcare for all. Frankly, I'm with you on that one, Alan. Single payer is not a great way to frame it for me. I think healthcare for all, and right now I think a preferred handle for it is Medicare for all, because people understand what that is. But I think we all can work on improving our framing of this whole issue, including the shorthand and how we refer to it. Thank you for that comment.
Yeah, and as we come close to wrapping up here, we'll see if anyone sends in any other questions. We'd also love to hear any comments you might have. I think there'll be an opportunity at the end of the webinar to do so. And if not, please go. I've just been told that probably won't happen. Please feel free to go to our website and contact us. Again, this is exploratory. Both Dan and I have long experiences working in the business world. Quite honestly, healthcare has not been one of the areas I've specialized, but as I've gotten more engaged and more outraged by what I see, I think it's absolutely essential that we look at this from a business perspective. Someone just commented that guaranteed healthcare is the preferred terminology by Healthy California. So, and again, I do think it's best.
Eric, can I say something?
Yeah,
this is Richard.
Go ahead, Richard.
Yeah, and I'm not I'm a manufacturer and a business person, and also have been a lawyer. But this is not an extraordinary first time out type of phenomenon. The rest of the industrialized world has adopted single payer as a best practice, as the model for the most efficient and equitable delivery of healthcare for a country. And your model is really a replication of what is common practice throughout the industrialized world. So I think your listeners should be confident that this is doable and practical, and what we have right now is really a non-system. It isn't. What we're going to do is systematize. And the only major change here is that the government will do what it does well. It will raise taxes. It will have a large escrow fund on which providers of care from which will be compensated. So this isn't rocket science. It's actually a simplification of how healthcare can and should be delivered.
Thank you,
Thank
Richard.
You, Richard.
Very useful comment. So again, we'd like to encourage people to send an email to Speaker Rendon, encouraging him to keep the bill moving forward. His email is assemblymember.rendon, R-E-N-D-O-N, at assembly.ca.gov. And also, please contact your local assembly members to have them encourage the speaker to do so. And I think we're going to wrap up here. Let me just I want to give the website one more time, and then please. Our website again is BA for Business Alliance, the number 4, and then HCAL.org, Healthy California, HCAL.org. And I'm going to sign off here, then I'll let Dan. Just thanks again. We look forward to working with you. This is very much a work in progress, and we need to put all our heads together as a business community to look for solutions that work economically, but also allow us to gain a political victory for something that Richard said is not really rocket science. It's been going on in many places all over the world for a long time.
I vote for Richard for benign despot. This is Dan. I just want to close out and say thank you, everybody, for joining us. A couple of last minute things. I think what we'll do is take all these questions and maybe write up FAQs, and we can email all the registrants with this information. And lastly, for sample letters and what to say when you call Rendon and other members of the Assembly, you can find those on the Healthy California Act website, which is healthycaliforniaact.org, all one word. So our website, BA, the number 4, hcal.org. Healthy California is healthycaliforniaact.org, and you can find all kinds of resources and information and all the latest news there. And
I just hope you'll leave this meeting, for those of you who have businesses, convinced that you will join the Business Alliance, and for those of you who don't, that you will convince at least one business person you know to check out our website.
Okay, I'm sorry. One last comment, and somebody asked if we could use your slides. We'll send you an email with a link on how you can download the slides. It's a very large file, so we'll work out how to get that to you. So I think we're at about 3 o'clock, and we're ready to sign off. And once again, thank you all for joining us, and spread the word.
Yep.
Onward and upward.
Definitely.
We're going to do this. It won't happen overnight.
It's going to take a fight. There are huge interests. Pharmaceutical companies, hospitals, insurers that really don't want to see this happen because they've got a pretty good deal going at the moment. And it's going to take a real community team effort of business, community, and labor to look out for the best interests of all of us. So that's our challenge. Thank you.
Thank you.